everyone. My name is Anthony Perissinotti. I'm a clinical pharmacist specialist in hematology at the University of Michigan. And today I want to introduce to you a new tool from ONCOassist called the Serum Asparaginase Activity Level Tool. So as you all know, asparaginase is an important component for the treatment of acute lymphoblastic leukemia, but its benefit depends on making sure asparagine is fully depleted. That's why monitoring serum asparaginase activity levels have become the standard of care. These levels act as surrogate markers for asparagine depletion, and they help catch inactivation. They help distinguish true allergy from infusion reactions, and they help guide when to adjust treatment. Now, many centers have started to use asparaginase activity levels. However, it's not always straightforward to know when to check levels or even how to interpret the results of the levels. This is where ONCOassist serum asparaginase activity level tool becomes invaluable. The tool will provide a rationale of why asparaginase activity levels should be drawn, when to obtain the levels, how to interpret the levels, and what clinical action you can take based off of this level. So to use it, you start by selecting the asparaginase preparation that you have given. So PEG asparaginase, CalPEG asparaginase, or Erwinia asparaginase. Next, you will indicate whether a hypersensitivity reaction occurred during administration. And if it did, also mark down its severity. And this is critical because reactions can increase the likelihood of inactivation, and the tool is going to adapt based their recommendation based off of whether an infusion reaction or reaction occurred. You're also going to record whether the patient received the full dose because the tool will also adjust its recommendations if the dose was incomplete. Finally, you will input the measured serum asparaginase activity level. Once this information is entered, the tool is going to instantly apply guideline-based logic to provide clear recommendations for you. So for example, if the activity level is therapeutic, it will advise continuing the current regimen. However, if the activity level is low, it'll provide a variety of different recommendations. For example, it might ask you to repeat the test. It might tell you on the next dose to slow down the infusion or provide pre-medications, or it might tell you, based off of that clinical scenario, to completely switch to a different formulation. This tool also will guide clinicians on grading allergic reactions, and it'll offer directions when the grade isn't so clear-cut. This ensures that we're consistently managing even some of those borderline grade 2 versus grade 3 cases. So for example, using activity levels can help distinguish between a grade 2 and a grade 3 when clinical symptoms might not be able to do that, or clinical symptoms are more subjective. Using the activity levels is going to be more objective. And obviously, the management between a grade 2 and a grade 3 are very different, and the tool is going to help in those gray areas. So to conclude, the ONCOassist serum asparaginase activity level tool integrates evidence-based recommendations directly into your clinical workflow. It will streamline decision-making, it'll minimize missed inactivation, and it'll guide when switching agents is necessary versus premature. This ensures safer, more consistent, and more effective use of asparaginase for every one of our patients. I hope this overview was helpful and encourages you all to give the tool a try. Thank you very much.